So my advocacy paper was about one very important public health topic that is used in daily life and is often overlooked. Many people in society believe that you're washing your hands as much as possible and sanitizing them with every chance you have is overall always good for your health. According to the American Cleaning Institute, the average adult washes their hands almost 8 times per day. Although it is safe to wash your hands around 8 to 10 times a day with no harm, it is not beneficial to wash your hands and apply hand sanitizer more than that or too often because it is actually not good for your health. It is not beneficial to wash your hands and apply hand sanitizer too frequently because the skin of the hand can quickly become damaged and will not be able to properly fight off germs and bacteria, which causes an overall higher risk of sickness. Washing hands and applying sanitizer less often will let the immune system become a lot stronger and able to fight off those bacteria and viruses that can infect a person every single day. One of my points in my primary argument states that one of the main and most significant reasons that too much hand washing is actually detrimental to your health because the body's immune system cannot develop enough immunity against the bacteria that commonly infect. In an article by Piedmont Healthcare, it states, by constantly using hand sanitizer, you can eliminate the bacteria that helps build up your immune system, allowing antibiotic-resistant bugs to enter your system and make you very sick. So, this pretty much states that the additional washing, scrubbing, and sanitizing of the hands deteriorates your first layer of your skin, which causes an overall imbalance of the natural pH of a hand and overall damaging the protective layer of a human's hand. This damage allows easier access of pathogens such as bacteria into the body. Looking at this at a biological point of view, the Centers for Disease Control and Prevention, the CDC, argues this point with an observation of healthcare providers such as nurses. So, they stated in an article, the numbers of organisms spread from the hands of nurses who washed frequently with an antimicrobial soap actually increased after a period of time. This increase is associated with declining skin health. In a recent survey, nurses with damaged hands were twice as likely to be colonized with S. hominis, S. aureus, and gram-negative bacteria, Enterococcus and Candida spp, and had a greater number of species colonizing the hands. So all of those strong bacteria were actually more likely found on the hands of healthcare providers such as nurses. So overall, this point of overwashing and overhand sanitizing your hands causes damage to the natural concentrations and layers of your skin, which in turn leads to a higher risk of bacterial contamination and illness. Another point in my primary argument states that the overuse of hand soaps and sanitizer also poses other threats to the health of an individual and a human's hands. This can lead to long-term skin problems, skin conditions, and even skin diseases. According to the Centers for Disease Control and Prevention, the CDC, they stated in an article, soaps and detergents have been described as the most damaging of all substances routinely applied to skin. Anionic and cationic detergents are more harmful than non-ionic detergents, and increased concentrations of surfactant result in more rapid, severe damage. Occupations such as healthcare, in which frequent hand washing is required, long-term changes in the skin can result in chronic damage, irritant contact dermatitis and eczema, and concomitant changes in the flora of your hands. In general, a constant amount of hand washing and antibacterial substance exposure to an individual's hands can lead to long-term problematic skin conditions, which also goes along with the fact that your immune system is not strong enough. One solution that I proposed for this problem in my advocacy paper is that applying moisturizers and lotions more frequently in replacement of extra washes. So antibacterial lotions, and moisturizers do in fact exist. The formulas of hand lotions and creams are recommended and proven to be persistently beneficial to an individual's health. In another article by the CDC, the Centers for Disease Control and Prevention, they stated that moisturizing is beneficial for skin health and reducing microbial dispersion from skin, regardless of whether the product used contains an antibacterial ingredient. Because of the differences in the content and formulations of lotions and creams, products vary greatly in their effectiveness. Moisturizers are highly effective and beneficial even when the product involves an antibacterial agent. This way, the human's hands can fight off strong bacteria and viruses with antibacterial control without the risk of problematic factors such as skin conditions and lesser immunity to these bacteria. So my counter-argument section of my advocacy paper stated that hand washing with antibacterial soaps and sanitizers can sometimes be beneficial for one's optimal health when it comes to the strength of some particular bacteria that is not commonly found on hands and is, in fact, very strong. A synthetic compound found commonly in antibacterial soaps and hand sanitizers, called triclosan, also known as a pesticide, has the ability to kill off resilient bacteria in which regular soap cannot. This poses the idea that some dangerous bacteria that triclosan can fight off against could actually threaten an individual's health if they are not using antibacterial substances too often to clean their hands. An article by Forbes stated how triclosan works. Triclosan is able to target many different types of bacteria by blocking the active site for an enzyme essential for bacterial fatty acid biosynthesis. Blocking the enzyme carrier protein reductase, triclosan prevents bacteria from synthesizing fatty acids, which they need for their cell membranes and for reproduction. Looking at this process in a scientific manner, just as Forbes did, triclosan, an active ingredient in antibacterial substances, does in fact display a beneficial outcome of using antibacterial soaps and hand sanitizers. All in all, antibacterial soaps pose a benefit to keeping specific bacterial risks away from deterring a human's health. So concluding all of the points that I made, bacterial soaps can specifically get rid of tough, more serious bacteria. It is not an excuse to use them habitually, and there are other harmless alternatives such as lotions and moisturizers. Obtaining a dangerous bacterial infection from not using the antibacterial soap is less of a health risk than developing sickness and skin problems from overusing soaps and hand sanitizer and such. Professions in healthcare, which many of us students are going to go into someday, such as doctors and nurses, where recurrent hand hygiene practices are necessary, is a prime example of how overwashing can result in health problems. These problems include, as I mentioned in my paper, less immunity towards common hand bacteria and pathogens. The overuse of hand soaps and sanitizers also induces a higher risk of skin conditions that no one wants, such as dermatitis and eczema. And then a solution to the idea of overwashing and over-sanitizing is, of course, using lotions and moisturizers that also sometimes do have antibacterial substance inside of them. These products can overall help restore the health of an individual's hand and also fight off these resilient bacteria and with safe antibacterial agents. In conclusion, appropriate regulation of hand washing and sanitizing is an essential part of a human's health and keeping yourself away from sicknesses. Thank you.